Hello, and thank you for making time to visit the Medicines Complete virtual exhibitor stand at this year's EAPC and for viewing our presentation. It's great to see you. I'm Sarah Charlesworth, the Senior Clinical Writer for Palliative Care and Specialist Pharmacist Editor for the Palliative Care Formulary for the last 20 years. I'm going to spend the next 10 minutes or so firstly introducing the Palliative Care Formulary, and then secondly using a case study to illustrate how this trusted resource supports you as health professionals to care for patients at the end of life. Now in its 7th print edition, which was recently launched this summer, the Palliative Care Formulary, or PCF as it's known, has been supporting health professionals for over 20 years. In 2018, Pharmaceutical Press, which is the Royal Pharmaceutical Society of Great Britain's knowledge business, acquired the Palliative Care Formulary and relaunched it as an online resource to better support health professionals at the point of care. It's now available via the online platform Medicines Complete, where it's updated monthly and it provides unrivaled and expert drug information for health professionals when caring for adult patients facing progressive life-limiting diseases. This trusted resource goes beyond standard references, providing unique, in-depth content and practical guidance on drugs and treatment regimes, including off-label use in both generalist and specialist situations. It provides relevant information for all types of health professionals to use across all stages of the palliative care patient journey. Firstly, a little about who's involved in PCF. Content production is overseen by our editorial board, which comprises 2 medically qualified editors-in-chief who are accredited specialists in palliative medicine. It also comprises other health professionals also working in palliative medicine and staff from Pharmaceutical Press, including myself as a specialist palliative care pharmacist. Expert advisors and contributors from both within the speciality and from specialities external to palliative medicine also assist in the preparation of new content and the regular review and updating of current content. Finally, our skilled in-house editorial team work hard to ensure timely monthly updates to the online content on Medicines Complete. As experts in producing leading resources for drug and healthcare information and having an editorial team working within the field, we understand the need for accurate and independent information that's specifically targeted to palliative care. We aim to ensure clear and concise information and actionable guidance to support confident decision-making on the use and administration of drugs and effective patient care at the end of life, so that you know that your patient management plan is a safe option and appropriate to meet your patient's specific needs. And finally, to enable you to explain the treatment to your patient and their family members. The Medicines Complete online platform brings together the world's leading resources for drug and healthcare information, and I'd now like to showcase some of the screenshots of examples of the Palliative Care Formulary content on the platform. One of the most frequently accessed areas of information is the section containing the compatibility charts for commonly used drug combinations given by continuous subcutaneous infusions. These charts can be used to assess whether it's possible to mix specific drugs together for co-administration via a syringe driver or pump to be administered continuously by subcutaneous infusion over 24 hours. The charts are a collation of both anecdotal and published evidence and report whether a combination is generally compatible, denoted by the green square, incompatible, denoted by the red square, or that there's mixed experience of compatibility or limits on the concentrations that can be mixed together, denoted by the yellow squares, with further details in the footnotes where necessary. As you can see, this chart is for 2 drug combinations diluted in water for injection, but we also have the charts available for dilutions in sodium chloride and charts for 3 drug combinations as well. This particular 3 drug chart contains combinations that include oxycodone diluted in saline. However, there are 16 charts in total for mixtures with morphine, hydromorphone, oxycodone, and non-opioids diluted in either water or saline. In addition to this, there are a total of 154 individual drug monographs and class monographs that provide instant access to clinical and dosage information. The information provided is specifically framed within the palliative care context and is extensively referenced where possible, but also contains specialist expert opinion and guidance. The date of last revision is always shown at the very top right-hand side of the monograph, and there are multiple sections within each monograph, such as dose and use, pharmacology, and drug interactions, which can be navigated to via the submenus. There are 15 quick clinical guides available, and these summarize the practical information from individual or multiple drug monographs for clinical use at the point of care, and are designed as useful, quick reference guides. And finally, we have 21 comprehensive sections on prescribing themes within palliative care, such as opioid dose conversion ratios, drugs and fitness to drive, and prescribing in renal or hepatic impairment. So these screenshots are obviously limited in demonstrating the full breadth of information available. And in a moment, we'd like to try and show you a live demonstration of one particular chapter of PCF. And to facilitate that, I'm going to talk you through a case study. The case study is based on a hepatic impairment chapter in PCF. And this was fully updated for PCF 7 by a multidisciplinary and multi-speciality working party of palliative care and hepatology experts, bringing together both published information and expert opinion about how to manage symptoms in these patients. The case study is available for you to download from the Medicines Complete exhibitor page. The case study follows a 55-year-old man with end-stage liver disease as a result of long-term excessive alcohol consumption. From his referral to palliative care, through the general approach to prescribing in these patients, choices of drugs for chronic symptom control such as pain and depression, and finally acute symptom control at the end of life. And if you can bear with me, we're now going to try and go to the live online version of the Medicines Complete PCF hepatic impairment page and demonstrate the areas that are referred to in the case study to give you a better sense of the platform. So the referral of this kind of non-cancer patient to palliative care is becoming more common, which is why we wanted to produce comprehensive guidance. Firstly, there's an introduction with background information available on chronic liver disease and the associated complications such as encephalopathy for those who are less familiar with this group of patients. The section on pharmacological impact of hepatic impairment also provides background information for the team on how end-stage liver disease affects drug action, specifically in the areas as drug absorption, distribution, metabolism, and excretion. The approach to prescribing in liver disease section helps to give general principles needed when prescribing for this group of patients and includes a handy list of red flags to look out for in the patient and with the drugs being used that would indicate that a dose reduction would be needed in these patients. In the case study, the patient has increasing pain and also becomes depressed. And the section on prescribing palliative care drugs for long-term use in chronic severe hepatic impairment gives specific information on the relative safety of drugs and starting doses. Within this section, you'll find individual subsections for commonly used classes of drugs needed for symptom control, such as opioids, antidepressants, antiemetics, and more. Looking specifically at the opioids as an example, you can see that each subsection contains comprehensive information on the pharmacokinetics of each drug within that class, and expert opinion of the best choice of drug from a relative hepatic safety point of view, with a summary table detailing specific starting doses, all to help you decide what is best for your specific patient. Finally, as the patient draws near to the end of life, there is guidance for the team on prescribing drugs for acute symptoms in the patient's last days of life, again with suggested starting doses.